We are Peninsula Community Health Services, and we are the Million Hearts Hypertension Control Champion.
The mission for Peninsula Community Health Services is to provide quality health care for all of our patients. And one of our big focuses is hypertension. And so this award really highlights the efforts that our providers and all of our staff have been putting in towards, providing exceptional care for our patients.
Yeah, I see a patient for hypertension follow-up. Okay, their blood pressure is maybe 150 over 96. So I say, well, we need to change some of the medication. So then I'll say, I would like to have, follow up. So usually the other part is that we make sure that patient follows up and have a schedule. But sometimes something happens, they don't show up. So then we have a very small amount of medication. They have 30 pills. So then what happens is for any of our refill requests, it goes to our pharmacy team. So then, for example, if I'm treating this patient with lisinopril, if the patient needs a refill, it goes to our pharmacy team. So then the pharmacy team looks at this refill request, is able to look at the progress notes of the primary care provider to see what the plan was, and they say, oh, their blood pressure was not at goal and wanted to be seen in 2 weeks, but somehow the patient was not able to make it. So they catch that, and then they do another scheduled appointment. So then the patient is able to get in. If we just gave a 1-year supply of lisinopril, we would never ever catch that. I mean, we would never have a follow-up to impact a change.
So the patient needs their medication refilled. We prompt them to call their pharmacy to make sure that we're getting the request for the right medication and the right dosing and all of that. And then that comes in via fax, comes into us in a big box. And so electronically we get those requests, and then we review the patient's chart for, if they're under controlled, if they're not controlled, if they're due for labs, if they're just due to come in for their, every 6-month visit or whatnot. And then we send a note to the call center if they need an appointment or if they need lab work or something, and then the call center calls the patient. So it's, a very integrated system that we have worked out.
I keep track of it at home, and I go in about every 6 weeks to have my provider read the list I have and check my blood pressure, and I think with that it seems to even it out if you don't have somebody, but everybody should have somebody and be checked, because it's very dangerous when it gets high. It's very dangerous. And you can get dizzy, you can fall down, especially as you're older, and you can, if you're driving, anything can happen. So I think it's just the best thing to do is keep that in mind and take care of yourself.
Well, if I were, advising someone who wanted to set up a system similar to ours, a big part of it is provider buy-in. We have great support from our medical providers and our medical director for this whole program, or the process that we play a part in. Our P&T committee sets guidelines which make it very easy to follow, so we don't have to pick and choose and feel like we're necessarily picking on patients or things like that. We have protocols in place. So I think that would be the most helpful thing is, make sure that you have support from your providers and protocols in place that are very clear so that everybody understands the process that makes it, the simplest flow for the patient care.
And another vital part, apart from quality director, is our pharmacy team that's been around for, I would say, over 8 years, and embedding them as part of the clinical, they're very much a clinical pharmacist. They're just not dispensing medication. They're looking at the chart, because we're electronically integrated. They can see what's going on, and developing guidelines for them to help us with controlling hypertension as well as diabetes has been, I think, part of our success.
I know I am making a difference. There is something to be said for, and I've said this before, but whether it's one person that I help or 100 people that I help, going home at the end of the day and knowing that I've helped somebody is a great feeling. And it's great to know that I am making a difference out there, and that people are living, they're being healthier, they're making the changes that they need to in order to live the healthy lifestyle.